Hello, I'm Dr. Cherry Bernardo Lazaro, a family and community medicine physician. In this lecture, I will be talking about community organizing as a method for community development and community-oriented primary care. These are my affiliations, and the following are the learning outcomes for this session. Please note that for the purpose of alignment to previous inputs, I made use some of the slides of Dr. Josefina Isidro La Peña on COPC with her permission, and I'm thankful for that. By now, I think we have agreed that communities can be defined in terms of geopolitical area, similarity in history, events, and circumstances, such as groups having the same ethnicity, gender, socioeconomic status, and religion, and healthcare coverage or practice population when we talk about our group of patients, such as hypertensive patients, elderly patients, family with terminally ill member, and others. We are aware that the model that we use in family and community medicine residency training programs for approaching communities is the community-oriented primary care or COPC, which basically integrates the concepts of clinical science or clinical care of individual patients with public health, which encompasses epidemiologic study and social interventions at the community level. I think this marriage and integration in concepts and practice make COPC different from plain clinical work or plain public health work, as both individual patient and the community are the foci of diagnosis, treatment, and ongoing surveillance. This is the process and steps involved in community-oriented primary care. But before we delve more into this and the topic at hand, which is community organizing, let me put some point of reflection first. Why do we as physicians, whether in training or in practice, need to do or have community engagement? Community engagement allows people for more informed decision making, increased sense of involvement and responsibility, and increased range of ideas and options for improvements in health. According to the World Health Organization, community engagement is a process by which people are enabled to become actively and genuinely involved in defining issues of concern to them, in making decisions about factors that affect their lives, in formulating and implementing policies, in planning and developing and delivering services, and taking action to achieve change. This picture in the slide is from an international NGO and showed how women led in tackling childhood malnutrition in northern Bangladesh. Thus, while community engagement is part of what we do as physicians, its intended results and benefits should be towards empowering people and promoting self-reliance of the community. Note, however, that community engagement is a process rather than an endpoint. It is an ongoing relationship between citizens, healthcare providers, and other community members and organizations to improve health through dialogue and discussions. It involves creating trust, building capacity, and working together. In a way, community engagement is part of community development. Note that community development does not refer to mainstream development approaches like modernization that equate development with economic growth and industrialization and fails to confront the class, gender, and ethnic relationships that determine who will benefit from the growth. Development is not also a welfare approach which equates humanitarian activities as goal of development. The community development perspective places responsibility for the development of the community on the people. The people working through their own organizations have the vision, know-how, capabilities, and experience to confront and solve the problems of underdevelopment. And external support, such as us, the physicians and institutions who are coming in as actually outsiders, are needed only as complement to their resources and efforts. These are the methods in community development. And note that among them is the emphasis of this lecture, which is community organizing. There are actually several definitions of community organizing in literature, these two to name a few. But for this lecture, I would like to adapt how our Filipino authors define community organizing. Community organizing is a continuous and sustained process of educating the people to understand and develop a critical awareness of their existing conditions, working with the people collectively and efficiently on their immediate and long-term problems, and mobilizing the people to develop capability and readiness to respond and take action on their immediate needs towards solving their long-term problems. Note that by adopting the said definition, we acknowledge that the responsibility to direct change lies with the people and not with the community organizer or organizers who are just there as facilitators. And for us facilitators of community organizing, our objectives would include to raise people's awareness about their situation to affect social change, to form structures and mechanisms to uphold basic rights and interests, to help people become aware of their potentials, to improve their quality of life, and to initiate actions that will bring about change. So, how do we go about community organizing, and what important principles should we observe or follow? These are the steps and principles in community organizing. While the principles would encompass the entire process, let me just emphasize some principles of community organizing that may be applicable in each step of the process. Before we can facilitate community organizing, we first have to enter the community. Here, you introduce yourself to the community, gather some basic information about the people, such as their culture, practice, and lifestyle. In this step, it would be ideal that you will act as equal among the community people and not someone who has the solutions for all their problems. You should not be regarded as superior or different from them. Once you are introduced to the members of the community, you can gradually join their small groups and continue to expand your knowledge about the conditions in that place. If community immersions are possible, live with the people, eat their food, do their chores, learn their way of life, and start working with the community. If we realize the hardships and problems that the people face, then we can better empathize, understand, and work together to address these problems. Once integrated into the community, you can already do some form of community study or situational analysis. But in doing this, please do not limit the participation of the people to mere answering survey questionnaires. Make sure to facilitate the people's participation in analyzing their situation by letting them examine their situation themselves and making them maybe realize that their problems are only manifestations of maybe more serious or heavier problems. In analyzing the problems in the community, the principle of felt need is important. Community organizers must learn what the community members' concerns are and find out what they identify as problems and not to tell them what their problem is. We have to discover what these felt needs are and to channel these and the people's discontent into organization and action. Related to the principle of felt need is the concept of issue selection. It is important to identify and differentiate the problems or things that are troubling the people from the issues or problems that the community feels strongly about. Because if the people feel strongly about issues, it facilitates concerted, collective, meaningful resolutions and actions. In this process, you may consider using the problem prioritization matrix, problem tree analysis, and other methods to help the community acquire the information they needed for issue selection. By the time the community has identified their problems, personalities will already emerge among them. We can observe who seem to have a deep understanding and concern for the people in the community. These are the potential leaders. Equip them with useful knowledge and experience for their future roles as leaders by initiating regular discussions. Sometimes the tendency is for the community to have the doctor or community organizer lead them. But we have to slowly educate and convince the community that their leaders must come from their ranks and not from the outside. The principle of leadership is important in this step. Note that leadership is key to successful community organizing. It is important that the leader is accepted, well respected, has a charisma or influence to a number of people, is democratic, has a track record of working for the common good, and demonstrated capability of making things work. Thus, people must be careful in the selection of leaders in the process of community organizing. From the potential leaders identified, the community can now form a core group consisting of members from different sectors in the community. It would be good that this group will continue to meet until each one of them accepts the challenge to organize the rest of the community. Once leaders or potential leaders are identified and the core group has been formed, their positions and roles may be formalized by setting up the organization. Election of leaders with participation of all the members may be done. During this time, members should be educated that in order for them to trust their organization, they must all participate in choosing their leaders in a democratic way. During the core group formation and setting up the organization, the principle of structure may be observed. Community organizing should develop an organizational structure that is simple and functional and based on the needs of the organization. It need not follow the structure of formal organizations. You may simply start by facilitating having working committees such as education, research, ways and means or logistics, memberships and mobilization, and liaison or negotiations, or whatever is applicable to the community and its activities. After developing the organizational structure, the last step in community organizing is strengthening this organization. We have to give the community or organized community the chance to move and work together on their own. Let the people learn how to identify the issues and problems confronting them. Let them plan the various activities they can perform together for the common good. Strengthen the organization until the people are truly convinced about their collective strength. As people are given the chance to move and work together on their own, then the important principle of participation is observed. Apart from the last step in community organizing, people affected by the problems must be actively involved in all the phases of the community organizing process, from needs identification, capability building, resource identification and utilization, and other decisive actions to solve problems, and even up to the evaluation. Community organizing or genuine community organizing would aim to enable people to be in control in the management of projects or programs, decide to address their problems, such that they should be involved in the entire decision-making process. Ornstein presents 8 levels of participation, with highest being citizen people power. Each step in the ladder shown in this figure reflects the amount of citizen power exercised. Obviously, in the spirit of people's participation, non-participation in the form of therapy or manipulation are not encouraged. Community organizers must also veer away from token participation such as just information giving, consultation, and placation efforts, and instead aim for, at the minimum, partnership so that eventually you can have delegated power and of course the highest level of participation, which is citizen control. Aside from participation, the principle of communication is also important in all the steps in the community organizing process. Open lines of communication must be established and maintained among community organizers, local leaders, and community members. Note that individual and group feedback is important in the communication process. Remember, however, that communication is a continuum. As physicians, we have the tendency to inform people of their health problems in the community. This is okay as long as we do not stop at informing. As community organizers, we have to move from informing to consulting or obtaining feedback to involving and collaborating with them, with the people, with the aim to eventually Empower them to make decisions and actions of their own. Finally, we have to communicate because people are motivated when they hear or know that development is taking place in their community. However, we wouldn't know if development or progress is taking place if evaluation or assessment is not done. Note that this is an ongoing process in community organizing. Efforts should be made to assess the gains of any mobilization or social action, its strengths and weaknesses, and to sum up the lessons learned. This ARA or action, reflection, action may be applied in observing this principle of evaluation. Again, these are the steps and principles in community organizing. Maybe your question at this time is, how do we apply these in community-oriented primary care or COPC? As you identify the community or target population at the start of your COPC work, you'd have to first enter the community and integrate with the people, not just to introduce yourself or your institution, but more importantly, to see if the community would be amenable to the collaborative work and partnership. In these initial stages, the principle of communication is very important in establishing rapport with the community people. Once integrated in the community, a community study or situational analysis can be done to identify the health needs of the community. From the several problems identified, you and the community can discuss which problems or problem to prioritize and have a detailed assessment of that prioritized problem. In these steps, you have to observe the principle of felt need and be sensitive that felt need is different from what you, as the healthcare provider, identify as the problem of the community. During the process of problem identification as well as planning for the intervention to address the problem prioritized, potential leaders can now be identified. These potential leaders can make up the core group, which later on can be formalized in developing the organizational structure. In these steps, the principles of leadership and structure in community organizing are very important. Then, in the implementation of the COPC program, it is important to strengthen the organized community by allowing them to work together on their own. Thus, in this step, as well as in all other steps in community organizing and COPC process, the principle of participation is very important to be observed and followed. In observing the principle of participation, it would be better to aim for citizen control, delegated power, or at the very least, partnership rather than non-participation and tokenism. Lastly, after implementation, the COPC project should be evaluated so that the community can work on their weaknesses and celebrate and enhance their strengths. The principle of evaluation is important in this stage. Note that while some principles of community organizing can apply more in certain steps, such as principles of felt need, leadership, structure, and evaluation, all the principles may apply or followed in any of the steps in community organizing, especially for principle of communication and principle of participation. Through this table, I would like to align the steps and principles of community organizing with the steps in community-oriented primary care. And I hope you would remember these concepts as I'm about to end this lecture. Sometimes when you do readings on the concept of community-oriented primary care, you will see that it may have the tendency to be prescriptive or paternalistic if left on its own or if just based on the decision of the healthcare provider. But if we incorporate the steps and principles of community organizing in doing our community-oriented primary care programs, then maybe we can move from being external support and facilitators to partners of the community and transform our COPC work from plain clinical care and public health work into activities done in partnerships and for community development. Keep in mind that as facilitators in community organizing, we cannot and should not do community organizing without the community. Or better yet, remember the so-called iron rule in community organizing, which is Never do for others what they can do for themselves. Thank you for listening.